Good afternoon, Peter Goertz. I'm a psychiatrist. Can I manifest anything I want? Can I be a millionaire tomorrow? Do our beliefs affect our emotional state? Can the immeasurable, for example, beliefs affect the measurable, for example, in a biochemical way, for instance, our emotional state? In my experience, things are not necessarily logical or black and white. An example, a patient, when I was an intern a long time ago, was scheduled for a simple surgical procedure, and she was very, very anxious, and no one understood really why. And she was saying before the surgical procedure, "I'm gonna die, I'm gonna die." And sure enough, she did. And it was a simple surgical procedure, but she died, as far as I recall, during or shortly after the procedure. So that might be an example, potentially, of someone's beliefs affecting their emotional state. And the emotional state then, of course, can affect the physical state. In our dreams or nightmares, we believe we're in the dream, of course. And our emotional state, for example, in a nightmare is not the most pleasant emotional state. And this may be similar to something observed in quantum physics. So if an observer is present, as per quantum physics, that changes the reality or what happens. So potentially, maybe our beliefs can affect our emotional state and thereby our so-called reality. And as per Goertz, in logic, in any system, any mathematical system, there are going to be true statements that are not provable within the mathematical system, as far as I understand. So life may not conform to logic. Another example of patients that are frequently seen in psychiatry is the type of patient who has grown up feeling inferior, felt inferior for their entire life, and feels depressed. So with a belief that one is inferior, it's understandable potentially that people feel depressed. Or another type of patient, a paranoid patient, who feels, let's say, their landlord is out to get them, mistreating them. They may well be angry at the landlord, and of course that can interfere or affect their interactions with their landlord. A pattern that often is notable in psychiatry is many patients have been abused in various ways, physically, sexually, emotionally. And it's never about blame or fault, but if these people do not have therapy and digest what happened, understand what happened, and work on shifting their patterns, often people who have been abused, for example, in childhood, are quite vulnerable to abuse further down the road. And the abuse can have many shapes and forms. They may have been sexually abused in childhood, but now they're being financially abused in a relationship. They're not being promoted at work, so essentially abused at work. And in certain cultures, if someone puts a spell on a person in certain cultures, or a hex, that person can die, apparently. So beliefs apparently can be very powerful, even leading to death, potentially. So what about the manifesting? Can I become a millionaire tomorrow? And what we're talking about is many people try to work on their beliefs so that they can manifest a different experience, a different reality, a different emotional state by changing their beliefs. Now, in my opinion, that can be quite tricky because we're often dealing with very strong subconscious or even unconscious beliefs that people are not necessarily aware of or fully aware of. So shifting those beliefs can be quite tricky, and working on shifting those beliefs takes, in my opinion, some work and takes time, at least potentially. So how do we change our subconscious or unconscious beliefs? That, in my opinion, is not necessarily easy, and maybe I can talk about that another time. Thank you.